everyone, and welcome to Medical Minute, sponsored by Kroger Health. I'm Sherry Hughes, and wow, we are in a brand new year. This is episode 60 of Medical Minute, and we are in season 2, right, Chris?
That is correct.
Okay, see, Chris is our producer and director, and that's the voice that you're hearing there. And I got it right. Thank you. And we're also here, joined with me is our director of precision oncology, Andy Guinigundo. Andy, how are you?
I'm great. Happy New Year.
Happy New Year to you as well. It's good to be back here and have a guest with us. Our guest today to start the year off is Sharon Noll, and she is with ReVital Cancer Rehabilitation, and you're a physical therapist.
I am. Thank you for having me, and Happy New Year to you guys.
Happy New Year.
Thank
It's
you.
good to be here with you. And you know what? As we kick the new year off, everyone's thinking about resolutions and things of that nature. But we're starting with cancer rehabilitation. As a cancer survivor myself, you know, you think sometimes that once you're done with treatments and you're kind of on your own a little bit, that you don't need anything else. But Sharon, you know that cancer rehabilitation for a cancer patient, it's like, you know, something that they could use at any point in time.
Absolutely. With ReVital Cancer, we are a national comprehensive cancer rehabilitation program, and our goal really is to help meet the unique needs and provide outcomes for patients that matter to them. You know, we really want to understand throughout their whole entire cancer journey what their problems are, what their goals are, and then using the specialized services and knowledge that we have at the hands of our compassionate and dedicated clinicians, we provide those services for our patients in the area.
And Andy, you know, having, you know, really helped a lot of cancer patients that, you know, there are things that a cancer patient goes through that's not, you know, like everybody else.
Yeah. No, I think, you know, when we think about, you know, rehabilitation or, you know, physical activity, it's often part of a long list of things that we're trying. It's like, oh, geez, we have to work on nausea. We got to work on, you know, other side effects that patient, you know, blood counts low, other things that we may, you know, worry about. And it's almost like, oh yeah, you got to exercise too. And we do emphasize it, yes, but we often don't, you know, and guilty of, you know, just saying do it, but not giving people the tools to really do it correctly and do it right.
Let's give them some tools right now. We got Sharon here in the house.
Thank goodness.
Sharon, what's the kind of like number one thing that, you know, you see cancer patients coming to your program in need of help with?
I think a lot of times it's pain, and a lot of times it's fatigue. The fatigue is a big one, and I think the misconception is that, you know, you just lay down and take a nap and you'll be fine, but that's not true. The cancer-related fatigue is different from a fatigue. I am lucky and have not had cancer. If I get tired, I take a nap, I wake up, I feel better. But people that are dealing with cancer-related fatigue, when they take a nap and they wake up, they don't feel better. So it's a very delicate balance between you have to do enough, but you can't do too much.
So are you guys physical therapists or occupational therapists, or how does that, I guess, realm differ from the work that you're doing in your program? Is it kind of intertwined?
It is. So occupational therapists and physical therapists are the ones that are doing the therapy to help people address all of those different needs. And we do different testing, and we take different metrics to help monitor their level of activity and their tolerance to activity, honestly, from the moment of diagnosis all the way through chemo, through surgery, through radiation, and into survivorship. And when there are changes to those metrics and those objective measures, that tells us that there might be something else going on, and we might need to intervene a little bit more.
Yeah. No. I always go back to the wise words of our own Dr. Jazzy, who tells every single patient, has this list of things he tells every single patient, and he always says, you know, exercise is anti-cancer therapy. And, you know, it helps with all those things. I always tell people, oh yeah, fatigue it doesn't matter what treatment you're on, the biggest complaint that I get is fatigue. And weirdly, the converse thing that you would think would help is what you do. You know, you be active to help your fatigue, which sounds counterintuitive, doesn't it?
But you got to be the right amount of active
Exactly.
and know what those parameters are.
Okay, so let me give you a case scenario here. With me, I sometimes still feel like I have a bit of neuropathy. So is that something this program could help with, or?
Sure. I mean, anytime that you're going to have neuropathic symptoms, you're going to end up with weakness. You can have, you know, it can be numbness. or it can be tingling, or it can be, burning sensation. The numbness and things like that are definitely things that we want to teach you tools to keep yourself safe. If it's in your hands, we want you to be aware of those things so that you don't burn yourself. If it's in your feet, we want to work on your balance and your ability to stay upright so that you don't fall and you don't end up in the emergency room and with other problems. So we're really trying to mitigate those things.
Right. So, and it's not, Andy, as we were saying, exercise. Everybody thinks of exercise, get out there, get physical, but you all take it a step further. Are you helping the patient to know, the proper things to do to alleviate the stress of their body? Or you mentioned earlier, you're like, this isn't something that's new, but it is new.
Yeah, it's not new. I mean, we've been doing cancer rehabilitation for 20 years, but it's actually been within the OCM and the NCCN guidelines for oncologists to bring rehabilitation specialists into the standard of care. But it's, oncologists, they work so hard. You guys do such phenomenal work. And my job really is to help take some of that burden off. When you have a patient that comes in and they're complaining of fatigue or they're complaining of neuropathy or pain, all of your staff is going to address those things because they're kind and they're caring, but they might not be able to give them real concrete things. We can give them tools and we can empower them to take back control of a part of their life and to do something positive in a situation when so much else seems hopeless and out of their hands.
I really love that. What would you say is like the number one thing that cancer patients come to get rehabbed on? What's that number one, concern or issue?
I think honestly, a lot of it is fatigue. A lot of it is weakness, and there's fear with both of those because it's fear of doing the wrong thing, fear of not doing the right thing, and they just don't know what to do. So, like we were talking earlier, you go and you have knee surgery or you have shoulder surgery. Your doctor's going to send you for physical therapy or occupational therapy, whichever one's most appropriate. If you're going to have, your breast removed, or you're going to have, you have a bone lesion and you have to have bone surgery, why in the world would you not send someone to therapy to have all of those physical impairments that have to follow addressed?
Andy, you see a lot of patients that come in for genetic counseling. Do they often, talk about other related issues or problems to you?
They do, but just like you would look at genetics as almost a subspecialty in itself, if we see a problem, like for example, they have a breathing problem, we're going to send a patient to the pulmonologist, the lung doctor. If we see they have a heart problem, they're going to go to the cardiologist. They're going to see the heart doctor. So, or have genetics questions, they're going to send them to someone like me. So why not, if someone has, physical activity and occupational therapy type questions, why not send them to experts like that?
Exactly. And Sharon, I was talking to you earlier saying that sometimes we think, it's been 2, 3, 4 years out. I look fine. People tell me all the time, oh, you look great, whatever. But sometimes, I usually feel good, but there are those times where I feel like, this is something, maybe a little something else is still not quite right. So do you see patients immediately after in most cases, or are you getting people that some of our audience might be at home right now saying, yeah, I feel like, I'm having issues with my back, and you're thinking it's either your age or, I don't work out enough, but it could literally, do you assess what the problem really could boil down to?
Yes,
or drill down
and
to?
The difference for us being a ReVital certified clinician is we got that extra education. So I'm going to ask the questions, and then I'm going to reach out to the doctors and say, okay, what kind of chemo did you have? How long did you have it? What kind of radiation? Where was the radiation field? Are you on any long-term medicines? Because all of those different drugs can have long-term effects. I had a patient that came into me. She was 10 years out of having breast surgery. She was coming in because she had shoulder pain. And we actually found out that she had a cardiac issue because the chemotherapy that she had caused a cardiotoxicity. And it was never diagnosed. So we sent her off. Now she's on blood pressure medicine and she's fine. But I would not, I'm a good clinician. I'm a better clinician now because I know I know to ask those questions, and I wouldn't have before.
How do people come to you all? How do you get your patients? Is it
All different ways. Sometimes people will come from the physician. We do have a number of oncologists that are sending, not enough to be truthful. And part of that's just because we haven't been able to get out to all of them. Some people will come through direct access. They find us online, or they're looking up, things that happen, and a family friend might refer them. So you can come to us from a physician. You can come to us in the state of Kentucky, Indiana, and Ohio. You don't have to have a physician referral. For a patient that's dealing with an oncology-related issue, we're going to reach out to the doctor because we need more information.
right? Is there consult? You know what? There's a lot of patients out there. You know what? They want to know, what's this going to cost me, or how long do I have to go? How about those things?
Sure. So we do take most major insurances, and a lot of the times there are different organizations that can help with payment and things like that too. Although honestly, I've never run into that yet. If you just go onto cancerrehab.com, or the company that offers this program locally is Novacare Rehabilitation. If you go to novacare.com and look for a facility in your area, you call any of them. They know, because I've drilled it into their heads, that if someone calls and asks a question related to cancer rehab, they're going to direct you to me, or they're going to direct you to another clinician who is able to provide those services to answer the questions.
Yeah. Now the term rehab almost implies that, okay, I've done all this stuff, now I should go and be rehabbed. I really almost think that, and you see in the guidelines, like for fatigue, that if you start from the, when you start therapy, that seems to help. Do you see that, do you see patients like that in a kind of a active treatment phase?
So honestly, the best way to go about it, if you have a patient from the moment they're diagnosed, if you send them for those pre-op measurements, I tell people, when you're getting ready to go through cancer treatment, you are training for a marathon, and you do not wake up on day one and run 26 miles. I mean, you can try, but it ain't going to work well.
Hello, somebody.
So if we can build your body up, the chemo's going to break you down. It just does, but you won't fall quite so far down.
You hear that term, prehab, right?
Yes.
Yeah.
Right. Again, if you're going to have a knee replacement, they're going to send you for prehab.
Right.
Why would you not? Cancer... here's the one message I really want people to know. I don't want people to settle.
Right.
I've survived cancer, but you don't have to survive cancer and deal with those side effects and those impairments. There is help.
Thank you, Sharon. You know what? You've definitely dropped some pearls of wisdom, and also, how folks can get the extra care that they might need if they're, going through cancer or have gone through it. So, Andy, thank you for being here with me, and Sharon, you as well, to start the new year off. Please, everyone, share this podcast and subscribe, and continue to join us as we go through this new year full of excitement for all the information that we're going to be getting and able to share with you. So thanks, and until the next time, Happy New Year.